Hi, my name is Sheila Brennan and I'm the course leader for the CBT route on the Diploma in Therapeutic Counselling. Here at the University of Wales, Newport, we've been teaching CBT, Cognitive Behaviour Therapy, since the mid-1990s. The profile of CBT in the UK has grown significantly over the last 10 years, and it seems a week doesn't go by without a reference to CBT in the national press or media. It has the strongest evidence base of all the psychotherapeutic approaches, and in the current guidelines from the National Institute of Clinical Excellence, often referred to as the NICE guidelines, it's the treatment of choice for many presenting psychological problems. So what are the theoretical underpinnings of working this way? What does taking a cognitive behavioural approach involve? And on the course here at Newport, how do we develop the essential knowledge and skills to be an effective practitioner? Over the next 12 minutes, I aim to address these questions. Whether you're interested in training as a counsellor or already a mental health professional, but interested in developing the way you practice, I hope this will help to build your understanding of this approach and answer the question, is CBT for me? I also hope it will be of use to those who may not work therapeutically, but in the broader area of facilitating behaviour change, either in the NHS, agencies or general organisational development work. You may have already signed up for one of our programmes, or maybe trying to decide whether to do so. And I'll discuss cognitive behaviour therapy, but we'll talk later about its application in non-clinical settings. So let me start by outlining the theory and concepts at the heart of a cognitive behavioural approach. I'll then go on to discuss the defining principles of working in this way. And what I hope to do throughout is to dispel many of the myths that have gathered around how CBT practitioners work. So what is CBT? There's a simple concept at the heart of CBT. It's the notion that the way people appraise their situation and experiences influences the way they feel, the emotion and the physiological response. It also influences how they behave. Appraisal as a cognitive process may be thoughts or images, and these are termed cognitions. These cognitions are often so automatic that we're not even aware of them. And this appraisal or interpretation is highly individual. No two people will bring the same lens or develop the same interpretation. We also appraise our emotions and physiological response and the consequences of our behaviour. So there is in fact a dynamic connection between these areas. Cognitions, the thoughts and the images, emotions and behaviour. And these can form a reinforcing cycle that's either helpful or unhelpful. This is the core of the cognitive model. When people are experiencing problems in their life and feel trapped with distressing emotions, there is likely to be a number of unhelpful or vicious cycles which can describe the process that maintains their distress. A cognitive behavioural practitioner will work firstly on discovering with the individual in a highly collaborative manner what these maintaining processes are. They will then look at how the client might break the cycle of distress by exploring more helpful ways of appraising experiences and also ways of modifying behaviour. And they will do this in line with goals set collaboratively with the client. And collaboration is a key term in CBT. Building a sound therapeutic alliance is of the utmost importance. The client needs to be actively engaged in understanding the tools and techniques so that they can apply them independently between sessions as well as in sessions. And the ultimate goal is that the client is their own therapist, and in this way it seeks to be an empowering therapy. The practitioner working in a transparent way, explaining and seeking agreement on what strategies and techniques might be employed. It's important to build trust, openness and confidence in you as the therapist, so that together a full formulation, understanding of the client's difficulties can be built and can guide the work needed to address their difficulties. Structure is also important in CBT. The therapist needs to skillfully guide the session once the agenda has been set. Sessions need to have a clear link to short and long-term goals once these have been agreed. The therapist must also, however, be flexible, and it's important to be open to revising their understanding of the client's difficulties as therapy progresses and adjust their approach accordingly. The idea of guided discovery is key to skillful practice. This approach is about the client and the therapist's guide working together, being curious and experimental, having hypotheses and testing them. This guided discovery can be about understanding the client's problems or finding effective ways of shifting their cognitions, their beliefs and behaviours. There are also regular reviews of progress in CBT. Some practitioners introduce questionnaires so that both client and therapist can understand if and to what extent there is progress being achieved. So how do we teach CBT at Newport on our diploma course? Firstly, it's important to say that the programme has been designed to prepare students to become accredited counsellors, as well as to build their specialist knowledge of CBT. Throughout the 3 modules of the 18-month programme, there is an interweaving of these three key elements: knowledge, skills and personal development. All of these elements are underpinned by an appreciation of research, both as consumers and creators of research. An understanding through personal development work of what we bring to the therapeutic encounter is also seen as a key part of the programme. Students must have a placement with a service offering counselling and be supervised in their practice. 100 hours of client work is a requirement during the course. CBT is in fact a family of therapies, and there are different therapeutic approaches. Here at Newport, we base much of the programme on the CBT tradition that derives from Aaron Beck's cognitive model. There are exciting developments in the CBT field generally, and these are included in the course, mainly as you progress through to semester 2 and 3. For example, mindfulness-based CBT and schema-focused work, where there's an even greater emphasis on working with the therapeutic relationship, is an area that we will touch on in semester 3. The use of imagery and techniques that derive from other therapeutic approaches can also be encompassed within the cognitive model. Alford and Beck have argued that cognitive therapy provides an integrative paradigm for clinical practice that is at the same time coherent and evolving.
The copyright to this recording is owned by the University of Wales, Newport.